Bismillah ar-Rahman ar-Rahim. We are going today to talk about the total parental nutrition or parenteral nutrition. Our objectives in this talk, we are going to talk about what is the definition of the parental nutrition, what is the indication of parental nutrition, what is the goals of parental nutrition, what energy needs, and TPN composition, how to administrate or administer the TPN, and what is the complication of the TPN, what is the clinical application or implications of the TPN, how to write the TPN, how to calculate TPN. So what is the definition of the total parental nutrition? Total parental nutrition is total supply of all nutrient. Total supply of all nutrient. So what is the meaning of all nutrient? All nutrients is macronutrient and micronutrient. Macronutrients, carbohydrates, fat, protein. Micronutrients, electrolytes and vitamins and mineral and trace element. But we are not giving like protein like carbohydrates, just will give the pre-digest form. Protein, I will give it in the TPN as amino acid. Carbohydrates, I will give it as dextrose. Fat as lipid emulsion, and the micronutrients, electrolytes and vitamins and mineral and trace element. So what is the goal of the TPN? The early aggressive use of adequate parenteral nutrition. It's early TPN compared to late or to delay the TPN. Actually, the early is better than late. It will decrease the mortality and morbidity. So early TPN better than the late TPN. So what is the goal of the TPN? I have to minimize the weight loss, maintain the weight status, and promote the weight gaining. So the goal of the TPN, decrease mortality and morbidity, and also improve short and long-term outcome. So reduce the risk of mortality, decrease the risk of morbidity, NEC and BPD, and also improve the growth and the neurodevelopmental outcome. This is our goal from the TPN. Our goal also for the TPN, especially for babies with IUGR babies, to correct the intrauterine growth restriction and also to prevent subsequent growth failure. TPN, it will provide actually anabolic state, to establish the anabolic state and prevent the catabolic state. How to establish the anabolic stage? Actually through to promote the nitrogen balance and also protein sparing. How to prevent the catabolic state? So we'll provide sufficient energy through the nitrogen and calories and carbohydrates, so it will help to prevent the catabolic state and to establish anabolic state. Also to achieve positive nitrogen balance. If you achieve the positive nitrogen balance, this means you achieve the anabolic state and to establish the anabolic state. Also to prevent the catabolic state through sufficient energy from carbohydrate or lipid and positive nitrogen. So our goal for intravenous nutrition, so anabolic state, catabolic state, if you maintain the anabolic state and to prevent the catabolic state, it will establish the growth and maturation during the critical postnatal period. So how can establish the anabolic state? To promote nitrogen retention and protein sparing. How to prevent the catabolic state? To provide energy for metabolic process. So good nutrition does not save life, it saves brains. What is the indication of the parenteral nutrition? Whenever enteral feeding is impossible, inadequate, if there is hunger, if there is feeding intolerance, if there is delaying of the full enteral feed, if there is inability to feed the baby or hemodynamic instability, TPN is indicated. So whenever enteral feeding is contraindicated, this TPN it will be indicated. What is the contraindication of the enteral feed? Hypoxic baby, asphyxiated baby, hypotensive baby, hypoperfused baby, hemodynamical instability, hypothermia. It's 4H: hypoxia, hypoperfusion, hypotension, the patient on maximum inotropic support, hemodynamical instability, and hypothermia, or there is others of ischemia. So the indication of the TPN, whenever enteral feeding is impossible in adequate udder, TPN is indicated. So what is the contraindication of the enteral feed? Make it the TPN or the parenteral nutrition is indicated during acute phase of any severe illness. Shocked baby, septic baby, neck baby with perforation, intraventricular hemorrhage, and hemodynamically unstable. All this contraindicate to start the enteral feed. So this is indication for parenteral nutrition. The hypoxic baby, hypotensive baby, hypothermic baby, hypoperfused baby, and hemodynamically unstable baby, also it's one of the indication for parenteral nutrition. So why full enteral feeding are delayed? As we mentioned, hypotensive baby, septic baby, and hypothermic baby. If there is prematurity, you have to start the parenteral nutrition. So another indications, so preterm infant less than 1.5 kg with contraindication to full enteral feed. Contraindication: hypoxia, hypoperfusion, hypotension on maximum inotropic support, hemodynamical instability. The baby will started hypothermia or having hypothermia. Large preterm and sick term baby, if you anticipate this baby, you can reach to full enteral feed longer than 3 to 5 days. So the indication of the TPN, preterm baby less than 1.5 with contraindication for full enteral feed, or large preterm babies and sick term babies, anticipate he reached full feed after 3 to 5 days. Another indication: preterm infant less than 30 weeks or less than 1.5 kg, or more than 30 weeks, more than 1.5 kg, unlikely to achieve full feed or within 3 to 5 days. Infant with high risk of neck. Who is the patient's high risk of neck? Babies with less than 30 weeks gestation or more than 30 weeks gestation with or absent reverse fetal umbilical artery flow, or asphyxiated baby, or having surgical neck, perforated neck, or having gastrointestinal tract abnormality. So the indication of the TPN, if there is contraindication for enteral feed. What is the contraindication for enteral feed? 4H, hypoperfusion, hypotension, hemodynamic instability, hypothermia. This is, you have to start the parenteral nutrition. If there is medical cause or surgical cause. Medical cause, the baby less than 30 weeks or less than 1.5 and cannot reach to full feed, and babies more than 30 week gestation and more than 1.5 unlikely to achieve full feed within 3 to 5 days. Surgical cause like perforated neck or gastrointestinal tract. So this is the indication of the TPN. Thank you. Assalamu alaikum.